Hello, welcome to my week 4 presentation where I will be applying the ethical problem solving model to policy/law versus morals. So this is not a situation I was personally in, but I do feel like it is a story that does apply to me as a social worker, because in my field I do battle between doing what is lawful and also under my company's policy, but yet also following my own personal morals. So let's start off with a little story. So let's say that you're a social worker and that you have worked closely with a 15-year-old boy, and you're aware of his personal upbringing and the struggles he has been through. You're also made aware that the child has not shown up at school, so you decide to pay him a visit at his home to see if everything is fine. So you show up and you find that he has a sore throat. So you decide to prepare him a meal and you start to notice symptoms of strep throat. And as a parent, you know that it could develop into something more serious and harm the child. So you decide to take him to the emergency room, but the hospital refuses to take in the child or even see him or provide treatment because he doesn't have any health insurance. So at this point, you feel stuck, that you can't even help the child, but then you start to think that you have a son who is also 15 years old and does have health insurance. So you think that you could take him, the boy, to another clinic and use your son's health insurance on him. And no harm, right? You end up helping the client. Well, wrong, because it is fraud to pretend to be someone else. But who are the stakeholders? Who would even be affected? So first of all, the social worker herself would be affected. The company would be affected, the client and her own child, and also the community, because they would lose trust in the social worker. So now on to analyzing the situation. As a social worker, your duty is to help the client, who is a 15-year-old child, and ensure his safety, but by also abiding by the company's policy and the law. From a virtue-based perspective, a good person would say to use the son's health insurance because it would be improving the child's situation, and the odds of someone finding out, well, may be slim. But if the social worker gets caught, she risks losing her job and not helping the child, because it would be showing him that as long as he does something good, it is okay to break the law. The principles applied here are legal. The social worker could face fraud charges if she used her son's health insurance. From a principle-based perspective, one would make a call to the Department of Children's Services for more intervention. The family and the child could receive proper intervention. The social worker would not ruin her reputation, as well as the companies. But the social worker may be scared that the child may be placed in foster care and the family be affected, broken, and the rapport would be broken as well. So like I said in the second slide, this is a true story. But as a social worker, I would have looked into resources to assist economically or contacted the Department of Children's Services for more intervention for the family and the child. And I would also be covering myself as a mandated reporter. But unfortunately, this exact situation rang true for Superintendent Casey Smitherman. She's from Indiana, and she did end up using her son's health insurance for the child. She was caught and charged with official misconduct, insurance fraud, insurance application fraud, and identity deception. But even though she had good intentions, it did have negative outcomes. So, for example, in the police report, the 15-year-old child did state that he knew he had to remove the names off the prescription bottles because he knew it was illegal to carry around a prescription bottle that wasn't his. And in the end, the Department of Children's Services did intervene, because the police did call it in, and they were able to assist with financial help in terms of providing health insurance or health care. The superintendent stated that she feared calling the Department of Children's Services initially because she didn't want the child to be placed into foster care. But if she would have done her research, the outcome would have been better. And I did choose to apply this story to my media presentation for this week because when I first came across it, I did remember saying to myself, what was she thinking? Like, what was the process of her thinking? But fortunately, she didn't lose her job, and the school did stick by her. But the superintendent did state that she felt that people had lost trust in her, even though she had good intentions. So I believe under utilitarianism, the superintendent probably probably would have made better decisions if she would have focused on the results and consequences. I do believe she focused more on the intentions, which she did state in an article that her intentions were good, and she did feel bad because she felt that people lost faith and trust in her as a superintendent, even though she didn't lose her job. But she did focus more on her intention as a person. She didn't really think it through. So under her own judgment, she thought, she was helping out the child. But I do believe the superintendent worked more under the virtue theory. She acted more on her own individual character instead of following the school's policies and rules. I do think she did a good thing. Unfortunately, it had negative consequences. It did benefit the child because he did receive medical assistance, but at the end of the day, she did end up breaking the law, and there were better alternatives to instead of what she did. So if she would have balanced out more the virtue and utilitarianism theory, it probably would have worked out better for her. Thank you for listening to my week 4 media presentation. I did leave a link to the story that I used for this media presentation.